Welcome back to The Healthline, issues that shape our well-being. I am your host, Dr. Andrea Ault-Brutus. In The Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving, complex healthcare system. In today's episode, we are welcoming two guests to discuss an innovative program here in Nassau County, the Perinatal and Infant Community Health Collaborative, or the PICHC program. Funded by the New York State Department of Health, the PICHC program aims to improve maternal and infant health outcomes by expanding access to early, comprehensive prenatal and perinatal care. We have representatives from two of the three amazing partners that have come together to deliver this program to birthing individuals in Nassau County. Bernice Baronville is the PICHC supervisor at Harmony Healthcare, Long Island, which operates the PICHC program. We also welcome Carol Burnett, Maternal Justice Program Manager at the Women's Diversity Network, which provides education, advocacy, and peer advising for the PICHC program. Bernice and Carol, welcome to The Healthline.
Good morning, and thank you for having us today, Andrea.
We love working with you.
Great. As I mentioned at the top of the show, the PICHC program is a program that operates out of Harmony Healthcare, Long Island, and the program aims to improve maternal and infant health outcomes for birthing individuals here in Nassau County. Bernice, can you tell us more about the PICHC program?
First, I would say about Harmony Healthcare Long Island, which is a nonprofit organization that provides healthcare and supportive services to communities across Long Island. Through its health centers throughout Nassau County, the organization works to improve access to care, reduce health disparities, and support the well-being of families. Harmony Healthcare Long Island offers services to underserved population regardless of their ability to pay, ensuring individual and family can access care and support they need.
If you could tell us a little bit more about the PICHC program, how long the program has been in existence, and how long mothers are in the program.
The Perinatal and Infant Community Health Collaborative Program, which we call PICHC program, is a 5-year grant initiative funded by the New York State Department of Health aimed at improving maternal and infant health outcome in Nassau County. The program is currently in its 4th year, and similar PICHC program operates in other counties across New York State. In Nassau County, the program is led by Harmony Healthcare Long Island in partnership with Hofstra University and the Women's Diversity Network. PICHC is a home visiting program that provides care coordination, health education, and connection to community resources to support healthy pregnancies and early childhood development. So mothers typically enroll during pregnancy and remain in the program through pregnancy until their child turns 2 years old, receiving ongoing support during both the prenatal and early childhood stages.
Carol, can you tell our audience why the PICHC program is so important?
Sure. The PICHC program is crucial for improving maternal and infant health by reducing disparities, lowering mortality rates, and promoting reproductive justice for Black and brown moms. In Nassau County, it is 3 to 4 times more likely that a Black mom will suffer complications or death during childbirth than her white counterpart, and the same statistics hold true for infants. It is our shared goal to promote birth preparedness and postpartum continuity of care to those most vulnerable and marginalized in the community in order to foster healthier pregnancies and families. We strive to reduce the negative health trends that disproportionately affect underserved birthing populations in Nassau. The PICHC program works to reduce racial, ethnic, and economic disparities in health outcomes, especially for those at high risk for poor birth outcomes, by working with partners to help us address the social determinants of health, such as poverty and structural racism. The program increases access to early and consistent prenatal and postpartum care, supporting Medicaid-eligible residents. The program is especially vital for supporting high-need individuals who do not actively engage in health care, offering them essential advocacy and care coordination. Many of our moms come from other countries and do not have family with them. We become their extended family during their pregnancy, birth, and beyond. We might be their only support systems. Many families feel uncomfortable and intimidated in healthcare centers. We empower and educate moms to advocate for themselves in order to make decisions about their own bodies. Being part of this program enables moms to receive comprehensive care coordination from pregnancy through postpartum, including guidance on newborn care, breastfeeding, and connecting with social services. We were able to connect families to health insurance, housing, food, and emergency support. Rapport and trust is established that many have not felt before, and this is key to helping moms in their pregnancy.
I understand that a key component of the PICHC program is the community outreach that is done. So tell us more, Carol, about the community outreach of the PICHC program.
We work with many local partners to address the social determinants of health, such as poverty and racism, that affect birth outcomes. We offer educational workshops 2 times a month in Spanish and 1 time a month in Haitian Creole. Partners, staff from health centers, birthing hospitals, and doctors' offices often facilitate these workshops. We offer a Black and Brown Mom Support Circle, a Dad Support Circle, and 4th Trimester Support Circle. We work with Harmony Health Centers to educate staff on the program so they can share with moms in OB/GYN and pediatrics during office hours. We work with 6 birthing hospitals on Long Island and have a close relationship with NUMIC. We work with libraries, which are trusted spaces in the community. We have done a screening and panel discussion on the film Aftershock with Hofstra and the Nassau County Perinatal Service Network. We are doing a screening and panel discussion of the film Beyond the Joy on the 20th of April at Hofstra from 6 to 9. We have presented the program to med students at Hofstra and New York Institute of Technology. We are working with interns from Hofstra, Old Westbury, and Capella. We have baby showers and graduation celebrations during the year, which is open to the community, and our partners share resources. Our next baby shower is scheduled for the 11th at Hofstra. The Women's Diversity Network, which is a partner in the PICHC program, received 3 grants and were able to provide 200 birth kits for moms in the program, as well as some other partner agencies.
And we're very excited that we're hosting 2 events in April in support of the PICHC program and to bring attention to issues in the area of maternal health. You mentioned the film screening we're doing on April 20th.
Yes.
That's going to be here at Hofstra University at 7 p.m. in our Student Center Theater. So please visit our School of Health Sciences website for information about that particular event. And also, as you mentioned, we have the community baby shower here at Hofstra on April 11th, and that's part of our National Public Health Week, which is taking place between April 8th and April 15th. But that particular event, the baby shower, is on April 11th, I believe at 11 a.m.?
11.
Yes. It's going to be in our Student Center as well. So please visit our website for information about that as well. So as we mentioned, community outreach is very important. A key role of that work is the community health workers. So Bernice, can you tell us more about the role of the community health worker in this particular program?
The community health workers play a critical role in this work, and their support is especially important to the community we serve. Our community health workers are bilingual and culturally aligned with the community, which help build trust and improve communication with family who may face language, cultural, and system barriers. They assist with enrollment, provide health education, and connect families to prenatal care, social services, and other community resources, helping ensuring mothers, women supported and engaged throughout their pregnancy and early childhood. Carol mentioned community outreach is a key component for the PICHC program. So the community health workers are able to also help with that, reaching out to the mom in the community and making sure they know about that great service.
And I had the pleasure of meeting some of your community health workers and some of the mothers who participate in the program. So do you mind sharing some of the testimonies of the mothers who have participated in the program? So Bernice, I'll have you go first, and then Carol.
Many mothers in the PICHC program regularly share that they feel deeply supported by their community health workers, with some seeing them as family, particularly those without relatives in the country. Even mothers with previous pregnancy note that the significant impact of the program, emphasizing how the support enhances their pregnancy experience and provide a higher level of knowledge and guidance than the prior pregnancy.
Carol, if you could share some
Many of the mothers in the program just don't want to be discharged, okay, when it's time to leave the program, okay? They've been so supported. We become their extended family. We become trusted. We become sisters, mothers, grandmothers, family, or whatever, okay? And it's just a wonderful experience. When the mothers actually do their testimonials at some of the workshops that we do or the celebrations, it actually brings people to tears to hear how supportive the program is of these moms in the community.
Yeah, and they're in the program, as was mentioned earlier, for 2 years, right? Yeah, so a lot of them don't want to leave.
They don't want to leave. And you know what? I think the community health workers still stay in touch with them, okay? If they need something, they know that they can come to us, okay? You know, we're their support. We're their family.
And I'm guessing you could also connect them to resources after they finish the program. Yeah,
most definitely.
We talked about some of the successes of the program, and I'm sure, you know, with all these types of programs, there are challenges. So what are some challenges that this program faces, and do you have any strategies in place to address these challenges? Bernice, I'll have you go again first, and then Carol.
The program faces different challenges, but affecting some clients. One of them currently is the fear related to immigration that can prevent attendance for prenatal care or postpartum care, and also we've seen the reduced supply from our partners organization. So to address this, we try to offer Uber rides to the clients to see if they can make it to their prenatal appointment. And, you know, early prenatal care is very important to us. So we make sure that they, instead of waiting outside and facing the fear to go for their appointment, we make sure we help them get to the doctor's office. And also to address the reduced supply, we try to work with our community partners to see how we can secure additional resources, and also rely on our community health workers to build trust, provide guidance, and connect families to needed support.
Great, thank you. Carol, would you like to add anything?
Sure. The program faces several challenges related to social determinants of health, healthcare system capacity, and community trust. Nassau County is marked by a history of segregation and redlining, which continues to impact health outcomes today. In Nassau County, Black and Hispanic birthing people face higher rates of maternal and infant mortality. Many of our families live below the federal poverty level, facing significant challenges with food insecurity, lack of transportation, unsafe housing, and environmental issues that complicate health outreach, which makes accessing prenatal and postpartum care difficult. There's a general distrust of government and public services among many residents in the community. This, combined with limited prenatal care access, hampers the program's ability to engage residents. Patients often feel unheard and pressured by providers, which can lead to a reluctance to seek further care. There is a rising need for mental health and substance abuse services, but a shortage of providers and limited capacity often leads to unmet needs. Some birthing people experience communication barriers with medical professionals, including feeling rushed or having their concerns ignored, which can lead to poor birth incomes. Despite these challenges, we continue to support the moms and families who enter the program with dignity and respect.
And you mentioned, for example, the issue of mental health. And again, I just want to reiterate the program that we have coming up here at Hofstra in April 20th, which is the film screening, is about postpartum depression. And that film title is Behind the Joy. So we're really honored to be partnering with the Women's Diversity Network, along with the National Coalition of 100 Black Women, Long Island chapter, to bring this film to the community here at Hofstra. Thinking about the future of the PICHC program, Bernice, what is the immediate future for the PICHC program?
In the immediate future, the PICHC program will continue to empower our moms and focus on expanding outreach to reach more families, strengthening partnership to address resources gap, and enhancing support for mothers throughout pregnancy. The program will also continue providing targeted guidance, health education, and care coordination through community health worker to ensure families remain engaged and supported. And like Carol mentioned, we will have a baby shower on April 11th at the Hofstra. It's always a good time to bring together the community and celebrate our moms.
And who's invited to the baby shower? Who do you tend to reach out to attend the baby shower?
It's open to the community,
Okay,
all
great.
the moms in Nassau County. We will be glad to receive them and celebrate them, and making sure we provide some great resources and also have fun on that day.
And just, again, for our listeners who are interested to attend the baby shower, they could visit Hofstra's website, hofstra.edu/ NPHW, and there's a whole list of events that we have for National Public Health Week, including the baby shower. So if you go to the baby shower segment on the website, you'll find a link to register for that event and for all the other events for National Public Health Week. So now, how can people learn more about the PICHC program if they wanted to be a part of the PICHC program? How can they find out more information?
People can learn more about the PICHC program by visiting the Harmony Healthcare Long Island website, which is the www.harmonyhealthcare.org, and also by calling the PICHC line at 516-396-0389 to request services. Organizations interested in partnering and receiving program flyers and brochure can also contact the PICHC line. And again, the phone number is 516-396-0389.
Great. Thank you so much, Bernice and Carol, for taking time to be on our podcast today and for telling our audience about the PICHC program. The work that you both do in the community and the PICHC program is so invaluable. So thank you so much, and we really appreciate all that you do. So this wraps up another episode of The Health Line, Issues That Shape Our Wellbeing. I would like to thank our studio engineer, John Mullen, and I'd like to thank our WRHU family, Radio Hofstra, for their help with the production of this podcast. Lastly, I would like to thank Hofstra School of Health Sciences for sponsoring this podcast. I am Dr. Andrea Ault-Brutus, and thank you for listening. Have a great day.